Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
In airway assistance, we should also assess the thyromental distance. Thyromental distance is the distance between the thyroid notch and the mentum in full extension of the neck. Normal thyromental distance is more than or equal to 6.5 centimeters. Borderline thyromental distance is between 6 to 6.5 centimeters. This borderline thyromental distance is seen in difficult intubation. Intubation is very difficult. Very difficult intubation, you have thyromental distance will be less than 6 centimeters. In modified airway assessment, you should also assess for range of neck movements. In airway resistance, in airway assessment, you should check for neck circumference. If neck circumference is more than 43 centimeters, then it is difficult intubate. It indicates difficult intubation. In airway resistance, we should see the upper lip bite test is done. Upper lip bite test is done. And in airway assessment, we will also do interincisor gap test. We will see the interincisor gap, that is the distance between the upper and lower incisors. This distance is calculated by opening the mouth wide open, and interincisor distance should be more than 3 finger breadth. Invest So in airway assessment, we have Mallampati scoring, modified Mallampati scoring, and thyromental distance. If thyromental distance is more than 6.5 centimeters, it is normal. If it is 6 to 6.5 centimeters, it is borderline, thus difficult intubation. If it is less than 6 centimeters, then it is very difficult intubation. We also see for neck range of neck movements. Neck circumference is also seen. If neck circumference is more than 43 centimeters, neck circumference more than 43 centimeters, then it is difficult intubation. Upper lip bite test is important, and if the interincisor gap is more than 3 finger breadths, it should be there more than 3 finger breadths.
thank you and thank you for watching.